Today, we're going to break down one of the most important topics in modern health. And that is heart disease. It remains the #1 cause of death in the United States, yet very few people actually understand what it really is, how it starts, and more importantly how much of it is preventable. By the end of this video, you'll understand the exact steps that protect your heart, the early signs people often ignore, and the science-backed strategies that can save lives. And stay with me to the end, because I'm going to share one surprising lifestyle habit that cuts heart disease risk almost instantly. Let's begin. Heart disease isn't a single condition. It's a collection of disorders that affect how the heart works. But they differ in forms, for example coronary artery disease. This is when the arteries supplying blood to the heart become narrowed or blocked. Imagine trying to water your garden through a hose filled with sand. The water still flows, but not enough to nourish anything. That's what happens inside the body when plaque builds up along the artery walls. Over time, the heart is starved of oxygen. And eventually, that can trigger a heart attack. The surprising part is that plaque doesn't form overnight. It can begin in childhood. But the real question is, what makes it build up so fast in some adults while barely progressing in others? The answer lies in a combination of habits, environment, and biology. Now let's talk about the causes. The most well-known cause is high cholesterol. But here's something most people don't realize. Cholesterol isn't the villain by itself. What actually causes danger is inflammation. When artery walls become irritated by smoking, high blood sugar, processed foods, stress, or even poor sleep, tiny cracks form. The body tries to repair these cracks by sending cholesterol to the site. Over time, this repair process builds a mound that narrows the vessel. This means inflammation is the spark, and cholesterol is the patchwork that becomes problematic. Another cause is high blood pressure. Think of your arteries like balloons. If the pressure inside keeps rising, the walls become weaker and stiffer. They can't expand normally, and this makes blockages build faster. Many people walk around with high blood pressure for years without knowing it. That's why it's called the silent killer. Diabetes is another major cause. High sugar levels damage artery walls the same way sandpaper scratches glass. The longer the damage continues, the higher the risk. And then we have lifestyle factors that speed everything up. Lack of exercise, smoking, excessive alcohol, and diets high in processed foods. But one of the biggest modern contributors is long-term stress. Chronic stress releases hormones that raise blood pressure and increase inflammation. It also triggers emotional eating, poor sleep, and weight gain. Stress quietly opens the door to heart disease and keeps it open for years. Now, let's move to symptoms. The difficult part is that early heart disease often has none. A person can look healthy, feel fine, and still have dangerously narrowed arteries. But as the condition worsens, several warning signs begin to appear. Pay attention to symptoms like chest pain or pressure that feels like someone is sitting on your chest. Pain that spreads to the left arm, jaw, or back. Shortness of breath after mild activity. Unusual fatigue. Swelling in the legs. Or heart palpitations that feel like skipped beats. Women often experience different symptoms. Instead of severe chest pain, they may feel nausea, dizziness, back pain, or sudden exhaustion. This is why women sometimes get delayed treatment. The earlier the recognition, the better the treatment. This is just the first half of the journey. Watch out for part 2, the concluding part, where I explain the proven prevention tips and the treatment methods that can help you or a loved one manage heart disease more effectively. Share this video with someone who may benefit, and remember to subscribe for more health content. Your heart matters, let's keep it healthy together.